Addiction epidemics are not just statistics. They are deeply human crises that touch families, communities, and entire nations. From the opioid crisis in North America to rising methamphetamine use in Asia and synthetic drug surges across Europe, the global picture is stark. Substance use disorders claim lives, strain healthcare systems, and devastate economies. But despite decades of punitive approaches, addiction continues to spread, proving that we cannot arrest or punish our way out of the problem. The way forward must focus on compassion, accessible treatment, and smart regulation to address the root causes rather than simply the consequences. Addiction is often misunderstood as a moral failing or a lack of willpower, but modern science has made it clear. It is a complex medical condition that changes the brain's structure and function. Genetics, trauma, mental health issues, and social environment all play a role in who develops an addiction and how it progresses. This understanding shifts the focus from blame to empathy, recognizing that those struggling with addiction deserve support, not stigma. Yet stigma remains one of the biggest barriers to addressing addiction epidemics. People who use drugs are often dehumanized, treated as criminals rather than individuals in need of care. This mindset discourages them from seeking help and isolates them from family and community support networks. Language matters. Referring to someone as a person with a substance use disorder rather than an addict reinforces their humanity and acknowledges that addiction is only one aspect of their identity. Compassion is not just about kindness. It is a public health necessity. Countries that have adopted compassionate approaches have seen remarkable results. Portugal, for example, decriminalized personal possession of drugs in 2001 and shifted its focus to treatment and harm reduction. The result was a dramatic drop in overdose deaths, HIV infections, and drug-related crime. Instead of punishment, individuals are offered counseling, rehabilitation, and social reintegration support. This model proves that when society treats addiction as a health issue, outcomes improve for everyone. Treatment is the cornerstone of any effective response to addiction epidemics. Unfortunately, access to treatment remains limited in many parts of the world, often due to cost, availability, or lack of trained professionals. Evidence-based treatments, such as medication-assisted therapy for opioid use disorder, cognitive behavioral therapy, and peer support programs, can significantly improve recovery rates. Harm reduction strategies, including needle exchange programs, supervised consumption sites, and naloxone distribution, save lives by preventing overdoses and reducing the spread of infectious diseases. But treatment must be holistic, addressing the physical, psychological, and social dimensions of addiction. Many people relapse because they return to the same environments and stressors that contributed to their substance use in the first place. Job training, stable housing, mental health services, and community support can help break this cycle, giving individuals the tools and stability they need to sustain recovery. Regulation plays a critical role in preventing addiction epidemics before they start. This means more than just enforcing drug laws. It involves controlling the supply of addictive substances, ensuring safe prescribing practices, and monitoring emerging drug trends. The opioid crisis in the United States, for instance, was fueled in part by aggressive pharmaceutical marketing and overprescription of painkillers. Tighter regulations on how these medications are marketed, prescribed, and monitored could have prevented much of the devastation. Regulation also applies to legal substances like alcohol and tobacco, which remain leading causes of preventable death worldwide. Policies such as age restrictions, advertising bans, higher taxes, and public education campaigns have been proven to reduce use and save lives. The same principles can be applied to newer challenges, such as vaping products and cannabis, ensuring that legalization or commercialization does not lead to another wave of addiction-related harm. Importantly, regulation should be informed by science, not politics or moral panic. Reactionary policies that focus solely on punishment often push drug use into dangerous, unregulated markets where substances are more potent and risky. Smart regulation can reduce harm, promote safer alternatives, and make it easier for individuals to seek help without fear of legal consequences. The fight against addiction epidemics is ultimately a fight for public health, dignity, and justice. Compassion ensures that we see the humanity in those struggling with substance use. Treatment offers a pathway out of addiction and toward recovery. Regulation creates a safer environment that prevents future crises. Together, these elements form a balanced, evidence-based approach that replaces cycles of punishment with cycles of healing. Addiction epidemics will not disappear overnight, but history shows that the way we respond can dramatically alter their impact. The choice is clear. We can continue to stigmatize, punish, and isolate, or we can build systems that heal, support, and prevent. The latter path may require courage, investment, and a shift in societal attitudes, but it offers the only real hope for lasting change.